Hello, I'm Hunter Schultz. I'm here at the Xtend Optimal Health Clinic in Panama City, Panama, and we have world famous Dr. Todd with us. Briefly, I am a longtime resident of Panama, and I'm also a client of Xtend. I've been through the program. And personally, I wrote the Expat Health Guide, which is the only book on getting great care as an expat on Amazon Kindle. Doctor, welcome to Panama. It's great to be here with you.
It's my first time. It's awesome.
Well, I hope you enjoy your stay. And before I ask about your background, I always ask doctors one question. Was there an aha moment that said, I'm going to be a doctor? Or was it maybe something in your family? But how did you wind up as a medical doctor?
My aha moment was when I was in 8th grade, and it had nothing to do with medicine per se. I got the insight that if we understood everything about DNA, that we would then know how to cure any disease or turn back the aging process so we could live a very long time in very youthful bodies. It was just a certainty that I had in 8th grade, so I began my own independent study of DNA, much more than any of my classmates. And I went to medical school just to keep my avenues open to study DNA.
That's an early age. 8th grade, I don't think I was thinking DNA back then. I was thinking girls. Something along
They
those
have
lines.
DNA, it's okay.
Yeah, that's true. So share with the audience a little bit about your background, the path you went from 8th grade and got into medical school. What's the path? How did you wind up in medical school? Where was it?
So I started at Northwestern University, and I learned about the program that they had there, where you spent 2 years at Northwestern and then went to medical school. But I didn't even know about that particular opportunity, and I was a candidate for it with my academic credentials and so forth. So I found another program, even better, which was at Johns Hopkins, and was called the 2-5 program. So you applied partway through your second year, and normally you don't apply to medical school till your 4th year. And if you get in, you spend your first year at Hopkins, partly medical, partly finishing undergrad, and then the next 4 years of medical school, you actually count your first year of medical school as your last year of college. So you get to save a year and go to one of the top 2 medical schools in the country. There's always this Harvard-Hopkins thing, who's number one. I think Hopkins was better, actually, just my personal opinion. And I loved it there, actually. So that's how I literally hopped from Northwestern, which is also an excellent school, to Hopkins to complete my training there, and then continued with internal medicine at Georgetown and did the full program plus a chief medical residency, where I was basically involved in the teaching program for the interns, residents, and medical students, which I loved doing that, and followed with 2 years of training in pulmonary and critical care medicine. So that's the conventional background.
The conventional background. Those of us who've been in Panama for any length of time know this is a very small world. And to tell you how small it is, I grew up in Wilmette, Illinois, which is one suburb north of Evanston. And my dad went to Northwestern.
Right.
So, small world.
I know that hood. It's cold in winter.
Yeah. The windy city, boy, let me tell you. My motto now is snow by choice. Yeah.
Or only for Christmas to go back.
Even then, I go to Florida now. That would be it. So, what was the most memorable moment for you in medical school?
The coolest moment in medical school was something that really took me by surprise. And this was the early part of second year, and I was doing microbiology, and we had labs and plate petri dishes and do the basic things to speciate organisms and learn about antibiotics. And I thought my instructor was kind of unimpressive, and my opinion changed about that the day he won a Nobel Prize,
That would do it.
which was about DNA,
Wow.
which was for having developed along with another Hopkins. This was Dr. Nathans and Dr. Smith winning the Nobel Prize for work in what are called restriction endonucleases. And what those do is cut DNA in very specific points when there's certain sequences. And if you have different restriction endonucleases and you cut it at different places, then it made it easier to create a whole map by stringing shorter sequences together, which you could do more easily than a whole chain of DNA, which is millions of bases long, which was a precursor to the Human Genome Project. So that day, it really changed my opinion. I got to drink champagne.
Yeah, that would do it.
And I did kind of figure, if he can do it, well, I could do it too.
You could do it too. So you mentioned the Genome Project, and that's one of the things when I think of personalized medicine, I think of genome, gut microbiome, proteomics coming. And as we move towards a deeper personalized medicine world and care, I'm wondering, what does optimal health mean for you?
I think there's a tendency to consider health as the absence of disease. Like someone's healthy if they don't have type 2 diabetes or hypertension or a wide range of other issues. And my view is quite a lot different from that. My view of optimal health is looking at the epigenetic archetype of that person, and based on diet, lifestyle, supplements, the way one uses the mind, advanced practices that are available in yoga, martial arts, and other systems, and now what we're doing with cellular medicine, to really go beyond optimal health as not being sick to maximizing the human potential. How young, fit, smart, fast, and strong can somebody be? What are we capable of?
I think that the concept of risk stratification, confirming the presence or absence of disease, may be one step, and you take it to the next level. Because I know in the US, we really don't spend a lot of time, at least in primary care, on the whole body and the whole mind, the whole ecosystem, if you will. And what we want to do as humans. I know that if you ask me what optimal health is, my answer might be, I want to live as long as possible, as active and doing the things that I want to do for as long as possible. And to others, it might be, I want to be golfing when I'm 90. So everyone has their own idea of what optimal health is.
Right.
And I think adding in these things creates a whole new perspective for people. And they need experts in order to do that. I'm going to touch on that in a minute. So when I hear the term regenerative medicine, I'd love for you to tell me, what do you think, in your opinion, what does regenerative medicine mean? What does it mean to you?
Well, that is a fundamental question, and I believe the answer has changed. The focus of regenerative medicine, per se, really was anti-aging medicine. So what you would do to slow down this process felt inevitable called aging. And there could be a focus, say, on regenerating an organ, like nourishing the liver or the kidneys in a certain way. So you would actually do more than just slow aging. You might actually reverse it and create a more youthful, functional organ. That wasn't generally the case, though, as a concept for the entire body. The idea was, well, if you do all the right stuff, eat right, sleep right, exercise right, and yoga, meditation, and do all these things, instead of aging and going downhill like that, maybe you go downhill more slowly, so that someone can be a much healthier 80-year-old if you do all the right stuff than if you don't, or maybe the other one doesn't even make it that far. What's exciting is that in the realm that I'm in, it's going beyond anti-aging to true age reversal. And I was at an event where I spoke with Dr. Frank Church of Harvard, who invented CRISPR. And he said, anti-aging is boring. I'm just interested in age reversal. How do we actually turn back the clock? How do you actually make someone biologically younger and get more years in a more youthful body, not just more years? And that really is what the focus of our pioneering work is. And we've developed a method where we actually prove we turn back the biological aging clock more, I believe, than any other method has done in history so far. We haven't seen the limit of it. And our measurement is looking at the DNA level. The most accurate clock that exists is the one developed by Dr. Stephen Horvath of UCLA. And I'm always tempted to talk about what that is technically, and I'll just say it, people can look it up online. There are two DNA aging clocks. One is well known, called telomeres. The idea that you have the ends of chromosomes that as the cells divide, they just get a little bit shorter. And the metaphor is like the little plastic on the tips of shoelaces. When that wears off, then the shoelaces get ruined, similar to DNA, that when the telomeres get to a certain shortened length, the cells tend to go into senescence and they don't replicate. That clock is not very accurate. Dr. Horvath says only about 14% accurate. The most accurate clock is called the epigenetic DNA methylation clock. And without going into all the technical details, when we're born, we go from being one cell to having expressed it into hundreds of types of cells. And the body needs a way to differentiate what a brain cell is supposed to do from what a liver cell is supposed to do. And different types of cells have different structures and make different types of proteins. And somehow, through some coding magic, the body finds a way to put these little groups with the carbon and 3 hydrogens, called methyl groups, in very specific locations on DNA. And that pattern changes from cell to cell to program what it's supposed to do. And so that's called DNA methylation. So this epigenetic clock, as cells divide, just like the telomeres get shorter as the cells divide, the DNA methylation pattern also loses its clarity. Like when you make copies of copies, sometimes the copies get less and less refined or accurate or crisp. And because that process is more clearly defined based on biological processes over time, that clock is really accurate. So using that clock with the method that we use that we can talk about, we've shown the ability to reverse biologic age to as much as 15 to 18 years compared to chronological age now.
Wow. So describe the mechanism a little bit.
Mm-hmm.
Anytime I hear measurement, I'm interested.
Mm-hmm.
So how do you actually measure biological age? I mean, what's the process?
Mm-hmm. So there are different ways of doing the test. The most accurate clock is a test done on blood. So the test where we got our first data, which was, yeah. They're all into it. Can we turn back the clock? And then we found we were turning it back as much as we had hoped, and that with repeated treatments, it just got better and better and better. So it's a blood test. That particular test just requires literally sticking a finger and providing a half cc of blood. And the lab uses something very sophisticated. It's a particular kind of chip that looks at the numbers or something like over 600,000 methylation locations on DNA. And that generates a ton of data, and it requires a lot of processing. And based on the algorithm that defines someone's biologic age at the DNA level in a very narrow window.
So we all know that when something's on the internet, it must be true. And I have to ask one question.
I rely on it.
Yeah. So how do you know someone is an expert in regenerative medicine? What are the hallmarks of someone? Why should I be listening to someone? I mean, we know your background. You go on the internet and you see regenerative medicine, and you've got a whole host of results from between Dr. Google and
Right.
How do you know what do you look for
Right.
in an expert?
And you're talking not at the research level like Dr. Horvath, who's a UCLA professor. You're talking about someone who's actually in the field that has a clinic that says regenerative medicine. How does a person decide between one and another, which would be a better choice?
That's the key. Is who is the if I'm looking for someone to do it.
Mm-hmm.
Maybe that's a better question. If I'm looking for someone who's really the expert, I've got a whole list of choices. What am I looking for as a consumer for a clinic?
Right. Well, you could just ask me. And I say that jokingly, also because it's incredibly difficult. There is a massive amount of confusion in this regenerative medicine space. The biggest confusion is around the area of cellular therapy called stem cell therapy. And there's also multiple adjunctive methods of anti-aging and even age reversal. And the challenge is that to really understand if you're going to interview a regenerative medicine clinic, or particularly the doctor in that clinic, you really need to know a lot of information even to ask the right questions. And the main confusion in the stem cell world is that when you say the word stem cell, it sounds like one thing. I got stem cells, and it either gave a particular result or it didn't. And the core of the confusion is that there is a whole hierarchy of stem cells in the body. It starts with a single fertilized cell, and the earliest cells are embryonic stem cells, which are very powerful but potentially medically hazardous. And then there's literally a branching tree of different types of stem cells that do different things. And I might even go through that for your understanding. And if someone watched this interview and heard, they would at least have a basic understanding of whether the type of stem cells that a clinic is using are a good choice in general, and whether it's a good choice for the type of issue. One of the things that I may do is literally create a kind of menu of all the different types of stem cells. And it sounds like one thing, but it's actually dozens of things. There are dozens of different types of stem cells in the body, and some may be a perfect fit for that situation, and others might not be a good fit at all. They may not be harmful, but they might not be helpful. It'd be a shame for someone to think they're getting the stem cell treatment that will be good for them if it's not the right fit. So to answer the question, there aren't a few simple things to differentiate one clinic from being better than another. The challenge is that I've seen some of the ads. Get stem cells, and they list almost the entire library of medical diseases, or at least degenerative medical diseases. And it's true that stem cells can, even just the regenerative process, the biggest risk factor for disease is getting older. The risk of virtually every chronic condition goes up with biologic age, which is a function of the process, which is why we're working on reversing it. Mm-hmm. That said, I'd say the first guidepost, if someone sees a regenerative medicine clinic, will be, what are their claims? Like, if they're claiming that they are curing everything, then that's already suspicious, because we're not really even allowed to say we treat, mitigate, prevent, or cure anything, unless in the US we go through a very strict and demanding regulatory process. Mm-hmm. So as someone's claiming they're curing stuff, it's already suggestive that they're overstating what they are really allowed to say. So that'd be first. If they're simply saying this is a regenerative process that can increase the health and vitality of the tissues, and that may make things better just by virtue of reversing or at least mitigating the aging process, then that's a good sign. And then the next step would be to ask them, like, specific cases, what are your results? And at least to be able to give examples of the sorts of things they've treated and the results that they've gotten. Because many clinics will specialize in a particular area. There are some that are more musculoskeletal orthopedic and will focus on joints and other musculoskeletal issues. Some may focus on neurologic issues, neurodegenerative disease, and then they'll have protocols that are designed to work to get very best results for that. So some are like cosmetic, and they want to grow your hair, make your face look better. So that'll be the next question. Well, who have you seen? What kinds of patients have you seen? And can you give me examples of results? Mm-hmm. And then if you're really qualifying people, you can ask them, well, have you published anything? Have you put anything in the peer-reviewed literature to show that you've gone through the scientific rigor of minimally publishing a case report or best case studies, or more ideally, having gone through the process of a formal clinical study?
Very good.
That's a long answer to a short question.
But it's important for people to have some benchmarks.
Yeah.
To know what to look for, at least have an idea.
Especially in this area, because it is the Wild West.
Yeah.
It really is. I've seen these claims that are, wow, that's pretty impressive. And as we know, if anything sounds like a panacea, that it cures everything, you always have to say, does it really do that, or is it marketing ploy?
Sure.
And for something to really be that broadly applicable, it must work through a very fundamental biological mechanism.
Mm. I want to switch gears for a second. You came out of residency, and what did you practice a specialty out of residency, or what?
I came out of a fellowship.
A fellowship.
Wow. In pulmonary and intensive care medicine.
Ah, okay.
Which by rights, I would be practicing that.
So, what?
But I didn't do that.
What made you shift from this conventional medicine to regenerative medicine? Was there one moment, or was there an aha moment, or was there a series of events that led you to it?
I believe in aha moments. They really make a difference. That's like changes trajectories.
Sure.
And my aha moment in shifting trajectories, being trained at Johns Hopkins and Georgetown, I was really groomed to become the head of an ICU, probably in an academic medical center somewhere with a teaching program, and take care of critically ill patients with multiple failing organs and all the complexity of how that needs to be managed. The alternative would be just doing pulmonary and critical care medicine in practice, not at an academic center. And I was very well connected. I could have easily done that. I was groomed for that. In 3 months before I finished all my training, I went to a 5-day program that was about the use of sound and sound pattern for accelerated learning and for enhancing the immune system. And the reason I went was because while I was in the ICUs as a pulmonary fellow doing bronchoscopies on AIDS patients, where unlike a person with a normal immune system, they get pneumonia, it's one thing. It's pneumococcal pneumonia, it's Haemophilus pneumonia, it's Klebsiella pneumonia, it's viral pneumonia. But with AIDS, when it's gone to that degree of immune suppression, there can be 3 or 4 or 5 different things going on at the same time. So you can't just accept one piece of data. We actually had to do invasive procedures. We had to basically put a tube into the lungs called bronchoscopy and do washings of the lungs and actually even biopsies called transbronchial biopsies to look at the tissue, just to make sure that we knew everything that was going on, because you had to treat it all. And as I was doing that, I was thinking, there must be a better way. And the drugs were promising, but it was clear because of how fundamental the mechanism was that they were likely to be toxic, and they were. And I had this idea. And this idea is the seed of everything that followed. And it goes back into basic physics. And one of my favorite concepts when I learned physics is called the natural frequency. And that means that just like a tuning fork, if you hit it on a table and it rings, it's not just tuning forks. Everything is like that. Everything vibrates. And it has what's called a natural frequency, which is the basic way it's going to vibrate if you give it a stimulus. And that's important because if you input energy at the natural frequency, the energy will build in the system, either to make it a high-powered system, or if you give it too much, it can actually shatter the whole system, like the opera singer who hits the note and the crystal wine glass goes poof.
Right.
And the idea, the intuition, was that the nucleic acid of HIV would somehow fold differently than human nucleic acid. And if there is a structural difference, then there would be a frequency or vibrational difference. And in theory, we could exploit that to have a vibrational remedy that wouldn't require any chemicals at all that, of course, have potential for side effects. So that's where the idea began. That's why I went to that course in the use of sound and sound patterns, which is also really interesting about there being this system of sounds that this group had created designed to activate dormant parts of the brain. And they have this whole audio program called Ultra Intelligence designed to increase the percent of the brain that we're actively using. And at that event, I met a woman who started as a computer troubleshooter and then became a medical intuitive.
What? A medical intuitive?
Medical intuitive.
Describe what that is, because my 8-year-old brain is going, wait, what? The 8-year-old in me is going, hold on. What's a medical intuitive?
It's a person who's developed their perceptual system so that they can actually tell whether a part of the body, an internal organ or system, isn't functioning at its optimal level, or if there is the presence of something undesirable like a virus or a toxin. And there's some medical intuitives who are really good that they can be as accurate as medical diagnostic technology.
Wow.
So I thought that'd be cool to learn.
And off you went.
And off I went.
Off you went. What are some of the things that you've, in terms of your own regenerative medicine discoveries, what has your path been like? What have you discovered? For the 8th grader in me. Picture me as an 8th grader, okay? That might help.
I'll give you a DNA book.
Okay.
That's when I started. So that's a really broad question. Want to define that a little bit more, because
I'm just wondering.
We've made many discoveries.
You made many discoveries. Okay. In terms of regenerative medicine, it's a big concept. In terms of, let's say, what they're doing here at Optimal Health, at Xtend, try relating it to what's being done here in Panama. Some of the discoveries.
Okay. My big eureka moment, my aha moment, with respect to what we're doing with the stem cell world, which I believe really is the core of regenerative medicine. Many things augment and enhance it, but I believe stem cells are the flagship if you want to turn back the aging clock. And then you can stack a whole bunch of stuff on it to make it work even better. We can talk about the best stacks too a little later if you like. The work that I did, the training I did when I moved to California, because that's where this person resided, and I basically did more general medicine to pay the bills instead of pulmonary medicine, because that's an 80-hour-a-week immersion. So in the context of that, it dialed up what I would call an inner world of perception. And the revelatory moment was literally having a vision in the context of that training, where my experience was communicating with the pure consciousness of DNA that described that the understanding of science about DNA is correct but incomplete. DNA is a huge information library. It's an encyclopedia of how to build thousands of different types of proteins. And it's more than that. In the context of the nucleus of a cell, we generally view DNA as the double helix. It's an icon branded in our brains. It's a gazillion logos by now. Yeah. And it's a little more complex than that physiologically. So the double helix actually supercoils. So it wraps around proteins called histones. And then that complex supercoils. So there are multiple levels of supercoiling. So physiologically in a cell, you have supercoiled DNA, which has been found to be superconducting, which isn't expected based upon the types of atoms that compose it. But a signal put down the core of DNA actually superconducts, even at room temperature. That wasn't known at that time, but it has been discovered more recently. That you have coils within coils in an environment of charges that are moving. And the information was that DNA is like a radio. That you have coils within coils and moving charges, and it's creating a type of vibrational signature. And then, as you know, in radio theory, a structure or device that can be used as a transmitter can also be configured to be a receiver.
Yeah, I do remember that actually.
Right.
Shop class, high school. Yeah, I do remember that.
That's right. So the idea was that in addition to the chemical signals that are slow, there's this communication between the DNA and all the cells, so the DNA in a sense is aware of things that are going on at a different level. And the key message from that vision was that if we understood the vibrational modes of DNA in health and disease, we would know how to instruct a sick cell to become healthy or an old cell to become young.
And there you are.
So basically, that vision told me what was possible, but left out the important point of how to do it. And that gets into the story of how we created the so-called song laser, with the notion that every molecule sings. And we needed to make a particular type of new waveform that would allow us literally to sing the song of molecules and to get that signal much more deeply into the body than was possible with conventional lasers. And I was led to this super cool Scotsman named Scott Strachan. And part of the story is that I had spoken to other scientists about this idea that we could create a signature so precise we could communicate with one part of DNA versus another. And everyone said, that's impossible. And Scott said, well, that's improbable. Which is a big step up from impossible. And in just 6 weeks, he took the idea of improbable and he actually invented a device which allowed us to create an entirely new type of laser waveform that would have new properties and new capabilities. And when we built the first device, the question was, will it do anything? One of the things that was created was the ability to take 2 laser waves, and lasers create waves that line up in phase. That's why it's coherent, and you get an amplified wave. The invention allows us to do the very sophisticated process of aligning waves in pairs exactly out of phase. So that when you add them together, you cancel, you sum to 0 both the electric and magnetic field vectors. So 2 visible photons in and visible light out, but it still has a set of structured potentials in the vacuum of space. And the big question was, this is really cool that we made this, and it may go thousands of times deeper through tissue or a medium than other lasers, but will it do anything? So our very first experiment was with a colleague of mine at the NIH, who at one point had been my trainee in medical training. She was a specialist in bone marrow transplantation, and she very kindly gave me 5 flasks of cells from the bone marrow with stem cell-like characteristics. And this wasn't one of those thoughtful experiments where you have a clear-cut hypothesis. It was basically the idea that cells have amplification cascades. If you give the right kind of signal, there are ways it can amplify. Like, that's how clotting works. A little signal causes an enzyme reaction which creates a product. That product amplifies to another signal, and it goes until the complexity of creating a clot to protect a blood vessel that's been cut from causing life-threatening bleeding. So it's like, let's just shine a laser on it and see if anything happens.
We'll wing it.
We didn't know what we'd expect. It was just It's brand new. Will it do anything? If it does, it's relevant. If not, then we still don't know. So we did that experiment, and we passed the beam of this very first laser of its type through the flasks along the long axis for 5, 10, 15, 30, and 60 minutes. Maybe duration makes a difference. And 1 day later was the OMFG moment. We'll call it the aha moment.
The aha moment, yeah, okay.
And want to guess what we saw? We saw something.
You saw something, what did you see?
Don't want to guess?
No, my 9th grade mind just went, no, don't even go there.
I'll think of Terry in the corner. That's more worthy. That's probably where my mind was at that age anyway, too. There was a Terry. So what we saw, and it was amazing because it had never been seen before, hadn't been possible before, is that in every single flask where the beam had been, the cells had been attracted to that location and had literally gathered together in a long line of cells big enough for the naked eye to see.
Oof. That's different.
Mm-hmm. So we had literally thrown it against the wall to see if something would stick. It was a massively important observation, which is the ability to create a frequency vibrational pattern that not only attracts stem cells to the signal, but gives them the stimulus to stick together as well. It's not just getting them there, they have to stay there if they're going to be useful. We had literally, what we now say poetically is we discovered how to create the song of the stem cells in life.
It sounds like you're doing control. I mean, controlling where the cells go.
We are.
Okay, I'm picking up, see?
That's why it was a big observation.
Okay, I went to 10th grade on that. So that gives you, what's the impact of being able to control the stem cells? I mean, I can kind of follow that if you're trying to repair a certain organ.
Mm-hmm.
Like a friend of mine down here, he was at the U.S. Embassy, he had a widowmaker, which is a massive heart attack. He was in hospital now.
Left wing disease, widowmaker.
And he went back to Miami and had experimental stem cell treatment. And he was given a 30% chance of any kind of life.
Mm-hmm.
And he's now back on the job, and he was with NCIS.
Mm-hmm.
And he's now a director, a sub-director at NCIS, but his heart function's back to 95%, back to doing all sorts of things. So they were going up through his thigh and up to his heart and injecting stem cells there. But this, I mean, you're using lasers. I mean, here I'm trying to figure this out. The
You're
laser.
on the right track.
I'm on the right track. Okay, there you go. So, give me a little example of maybe it's the brain or spine, or how would this be used in terms of therapy?
Mm-hmm. Well, I'll use your own example.
Okay.
So, one of the hopes for stem cell therapy is improving the function of a failing heart. Mm-hmm. And the basic figure is that a normal heart pumps out 50 to 65% of the blood with each beat. That's called the ejection fraction. If it drops to less than 30%, it's considered severe heart failure, and the prognosis is only a 30% 1-year survival when it degenerates to that level. And before we did our first clinical experiment, there was an article published which is called a meta-analysis, which means instead of reporting a single study, it was basically a compilation of the results of multiple published studies. And this reviewed 1,494 patients who had the procedure that you described, which is doing a cardiac cath, putting a catheter through the femoral artery, into the aorta in the chest, and ultimately cannulating the arteries that supply the heart and injecting the stem cells straight into the coronary arteries. And one of the big issues with stem cell therapy is actually delivering the cells where you want them to go, because they're not going to regenerate a particular tissue if they don't even get there. And that compilation showed that with invasive cardiac cath, the average improvement in function was about 8% after 6 months. Now, our method was much more elegant and way less invasive. So rather than doing a cardiac cath, we simply gave the cells intravenously with laser guidance to the heart. And the difference using the laser is quite profound. The reason cardiac cath was being used was if they gave the stem cells IV, they typically found it just didn't do very much because they weren't getting enough cells to the heart to make a difference. The potency of this laser guided signal was shown in this experiment. So compared to an 8% improvement after 6 months with cardiac catheterization into the coronary's delivery, in just 3 days we already had a 14% improvement IV with laser guidance, which then improved to 25% in 2 months, 37% in 2 months, and 50% in 3 months.
So when you're talking about laser guidance, you're injecting into, let's say, my arm.
Into a vein in the arm.
I mean, is it literally a laser that's going like this? I mean,
No.
Okay.
No. There is intravenous laser therapy where fiber optic is placed into a vein, and then lasers different frequencies input photons into the blood, and that there's a whole art and series of applications for that. This is using this new type of laser that we call a song laser, and I can explain what song means. Laser is an acronym, song is too. And the signal from this laser, based on what we've observed, compared to the 5 millimeters depth of penetration, which is typical for that wavelength in red, we believe at least part of that waveform is going all the way through the body from one side to the other. So this low energy beam, red, with less physical power than in a laser pointer, it's not about the amount of power, it's about the precision of information, that wherever we apply it, along that axis, it's going all the way through the body from one side to the other. And wherever that signal is, it's the attractor field, the homing field for the stem cells to go there, stay there, and regenerate there.
Laser targeting.
Right. So this really only required injecting the cells and giving this signal for 5 minutes over the heart from the front and 5 minutes over the heart from the left lateral side, because the heart's more on the left than the right. And the results, on average, were 6 times better in terms of improved heart function than giving the cells by cardiac cath.
Amazing. So I want to jump, since
Did
we're
that
talking,
answer the question?
it's amazing what's going on.
Yeah.
The capabilities that we have now are phenomenal. And one of the things that I wanted to explore a little bit, there are a lot of news stories about stem cells in general. And I know here at Xtend, they are working with what are called V cells. which is something that I know you know a thing or two about. So can you give the audience an overview of, I think you mentioned something about stem cells earlier, different types of stem cells, and a little bit of an overview there, and then specifically more about B cells and what they do. Keeping in mind that the 8th grader in me is going, hi, I'm here.
I really work to make it understandable without a lot of background before we begin. And that is really the key question that can clear up the confusion in this whole space. And it's not that V cells are the perfect cell for every occasion. And as you will hear, it's in general the most useful cell for many circumstances. Let's begin at the beginning. So we spoke briefly about embryonic stem cells, which when the first cell is formed from the fertilization event, that initial cell divides, and when it gets to about the 30 cell level, it's called a blastocyst. And those cells are true embryonic stem cells. And it's called totipotent, which means if you took those 30 cells and put them in 30 ready wombs, you could create 30 new people. A totipotent stem cell can make a whole new person. However, it's the only type of stem cell associated with a significant risk, which is the formation of benign tumors that can have all the tissue elements in them. So it's really weird. They can be as big as a cantaloupe or a football and have hair and skin and teeth and nails and muscles and bone and blood vessels all kind of wrapped together, a great big giant hairball with a bunch of weird stuff in it. And if they get big enough and process up, they may need to be removed surgically. So generally, one doesn't want one of those.
Right.
So for that reason, and probably appropriately so, there was a moratorium on the use of embryonic stem cells to go to something safer. Just past embryonic, we have what's called pluripotent, which means many potencies. After the blastocyst stage, there's the formation of what are called the 3 primary germ layers that you've probably heard: endoderm, mesoderm, and ectoderm. And each of those layers works together and forms particular tissues of the body. So ectoderm is skin, brain, and spinal cord, and teeth. Mesoderm is muscle, bone, cartilage, tendon, and fat. Endoderm forms digestive organs. Those are the basic distinctions. A pluripotent stem cell can make any of the 3 germ layers, and by extension can become any type of cell in the body. At the next level, you have germ layer derived stem cells. And in practice, what's really used a lot is the mesoderm part, which are the so-called stem cells from fat and bone marrow. These mesenchymal stem cells is the name for it, that come from fat MSCs or from the bone marrow, and those can be useful for certain things. Then beyond that, it further differentiates into single tissue types of stem cells. There's a type of stem cell for the liver, the heart, the lung, the skin, which actually resides in the follicle. The brain has 3 types of stem cells. So you can see when you say stem cell, well, where is it in the hierarchy? What is it designed to do? And it's also important to know how old is the person, because stem cells, with one exception, get older and older. At least one exception, or there might be others, but there's one I know for sure. So that if you're using MSCs from fat to repair a joint, which is well suited, and MSC is designed to do cartilage, bone, tendon, so it's a good choice of cell. For a 20-year-old, it works great. It's very powerful. But for an 80-year-old, it hardly works at all. So the potency of those types of stem cells gets less and less over time. So you only have to ask, what is the source of cell, where is it going, and if there are age-related differences, what is the age of the person who is donating their own cells to be used elsewhere. There is also a factor of size. The size of an MSC is 12 to 30 microns, which is small, but pulmonary capillaries are even smaller. They're about 6 microns. So if you give those IV, almost all of them get stuck in the lung. It's just mechanical filter. So if you want those cells to maybe do something for the brain, the cells aren't going to get there. Some of the growth factors they make may have a systemic influence for regeneration, but the actual cells have little likelihood of getting there. Which then takes us to the V cell and why they're so useful. So the full phrase is VSEL, which stands for very small embryonic-like stem cell. And the two things that are really, really important is one, that it's very small because it means it can get through the lung. And by very small, it's literally just 1 to 2 microns, really small. Literally just about the size of a bare nucleus and sometimes a tiny little bit of cytoplasm that you can see. The other is that they're embryonic-like. And it's important that it's like and not true embryonic. They're embryonic-like because they still express some of the early stage proteins of the very early cells, which is how we can tell that it's a VSCL as opposed to another type of stem cell. And I'll just call them V cells for short, now that I've defined what VSCL is in the long phrase, and it's a lot easier just to say V cell, but that's what I'll be referring to. The other remarkable characteristic of the V cell is that for unknown reasons, and this is actually the gift and the discovery, they go into hibernation at around the time that we're born. So these incredibly powerful stem cells that can make any type of tissue in the body, they go to sleep.
Great.
They go into dormancy. And because they're dormant, they're not dividing. Because they're not dividing, the telomeres are getting shorter. The methylation pattern isn't showing the pattern of older biological agents.
Stasis.
Yep.
Okay.
So we've put our most powerful type of stem cell in the body in suspended animation until we wake them up.
And what usually wakes them up?
There are different methods that have been used. One that's talked about is cold shock, where you cool them to a low temperature for 12 hours. And there's some benefit from that. The most effective, and what we've published, is what we do with the laser. So our first publication in this area, which we call our Manchester paper, which we co-authored with Dr. Peter Hollins, who was part of the team that created in vitro fertilization, awarded the Nobel Prize in 2010. So our collaborator is someone whose work has already been associated with the Nobel Prize, and he's excited because he thinks this is as or more fundamental. And at his lab in Manchester, we showed that we have optimized our application of the laser. We looked at different durations, and fortuitously, or maybe intuitively, we found that the duration we chose for activating the cells was what gave the best result. So in the study, we found that just 1 minute of using this unique type of laser, and it has certain other properties that I haven't discussed yet. If you want to get technical, maybe you want to go there, maybe you don't. But let's just say that this is a function of this new type of waveform that creates depth of penetration and very high pulse repetition frequencies that even after just a minute, the cells were more active and we could count more of them. After 2 minutes, the effect was greater. After 3 minutes, it was a bit more, not as much more between 1 and 2, but it was the most. At 6 minutes, the effect was reduced. 9 minutes is like not doing it at all. So we'd found the optimum window to awaken these cells. And in other work, I saw that in just a few days after the laser stimulation, they'd gone from being really small to having 2 to 3 times the diameter. Their cytoplasm was expanding and they were starting to replicate. So we have shown, not only that the cells exist, there's even a controversy about that, and that the laser process almost immediately makes the counts more than twice as high. And we published a biophysics paper to explain our theory of that, and we won't go there.
Okay.
But the point is that, as far as I'm aware, the single most efficient and potent way to awaken these lifelong sleeping, very powerful V cells is with the laser process that we've developed. And what's even cooler is that when we give them IV, we can then increase the probability that more of the cells go where we want them by the laser guidance process.
Got it. Okay. So for someone like me I'm 63, and if I'm looking at, well, I should probably ask you, I mean, the older we get, what are some of the top things that you would use this process on? I've read about these cells a little bit, and I understand that the brain, the spine, are 2 areas in which they excel.
Mm-hmm.
And correct me if I'm wrong, but tell me a little bit about what you can do with the spine. I mean, what are V cells going to do for someone, let's say, who's got, I have lower back pain.
Mm-hmm.
Anything there?
You don't need to.
I'd love to get rid of it.
We have ways to suggest. Actually, I always say we can't guarantee any result in a particular person, yet
Right.
we often see very good results. We usually see very good results. So there are a couple of questions there. And I'll answer your personal question first. This question about the spine, and then I'll talk about the general rationale of use and the things that we see.
Mm-hmm.
So, our most dramatic case to date was in a Spanish-speaking country, which was in Mexico. And this was a chief of police who was basically fighting the drug wars and did great till he was shot 4 times and left for dead. Spent 7 months in the ICU and survived, but was left with a complete mid-thoracic spinal injury. So that from the middle of his chest down, he had no sensation and couldn't move a muscle. So basically, functionally a complete spinal injury at the T5 or 5th thoracic or mid-thoracic level. So we did our first procedure for him, which was simply using the laser to direct the cells we just infused to the damaged part of the spinal cord. So functionally, we knew exactly where that was, which thoracic vertebral levels it was, and we literally just sent them 2 levels above through the injury to 2 levels below, with the intention of bringing in the stem cells to create wiring across the injury. And 6 weeks later, we saw him again, and his sensation had improved 15 centimeters down his front and back.
Wow.
And normally, that would never come back. He was also quite pleased to announce that he had 2 erections that he described as too high. And I have not generally heard of that being called too
Complaint.
high.
Yeah, okay.
I think it was just like, how you say, the sensation was intense because the nerves were coming back.
Mm-hmm.
But he was pretty pleased about it.
I can imagine.
Yeah. So that was the result of the first treatment. Second treatment, we repeated that. And again, saw about 6 weeks later. And then he described that his sister was cutting his toenail and he said, ouch. And she said, you're not supposed to feel that. Well, I said, I did. No, you don't. Yes, I did. I really did. So sensation came back all the way to his toes. He could actually start to wiggle his toes. And then we did one more treatment. And after that and some months of therapy, he was able to walk and ride a bike again.
Amazing. And has that been written up? I mean, that's, you've published it, or?
Oh, well, it's in patent documents, so it's published. It's published in that rate in terms of a peer-reviewed journal. No. One of the doctors in our network trained at Johns Hopkins like I did, cool place, and she's a neurosurgeon, and she's treated 20 spinal injury cases and all have improved in some way.
Wow.
So looking at publishing that as a case series.
I mean, with the brain and the spine, but I read a little bit of research. I read that you're able to, the V cells can actually improve. You mentioned in vitro. These can help produce eggs and sperm, which has profound implications in fertility.
Mm-hmm.
So a little bit about that. I'd love to. I know the main thing is spinal, brain, and other parts of the body, but this is a real eye-opener to me, that you can actually bring back the ability to have kids.
Mm-hmm.
I mean, I'm sure up to a point, because
We don't know that point.
well, yeah, you don't know the point, but I mean, I'm sure there are other factors that, do you really want to, other parts of the body, are you going to be able to cope with having a kid? But, I mean, do you see like 70-year-olds having kids with this? I mean, is that just way out? But I'm sorry, go with the simple fact that you can do this, that the V cells can do this, is fascinating.
I'll tell you some stories. So, the most amusing was a woman 15 years postmenopausal. And we have a general anti-aging protocol that I'll describe because it's our most commonly done procedure, just for age reversal, not for a particular issue. And she contacted us a month later and said that she was having ovulation symptoms again. And then she started having her menstrual period, and for some reason was concerned that she might be pregnant and got a pregnancy test kit. And when her husband got home, he was a little bit shocked. He said, "What do you have a pregnancy test kit for? Don't you remember I had a vasectomy 15 years ago?"
Oh boy.
And she assured him that there wasn't anybody else, but that because of this regeneration of function, she was concerned that she might have been impregnated. So even if women are years postmenopausal, we ask them if we want them to send eggs to the ovaries. We've seen men's testosterone levels just sending the cells to the testes with the laser raise testosterone from the lowish level of 400 to a high level of 800. I just heard one of the cases recently where someone had an essentially absent sperm count that's now normal with this treatment. And we're working with one of the world leaders in IVF to actually look at this in a more systematic way, and he's even more aggressive. He's injecting the cells right into the ovaries. whereas we just do laser guidance. But even laser guidance seems to have a significant effect. Or we had a couple that failed IVF 5 times, and both partners got the treatment, and a month later she conceived. So yeah, this may have a role.
Sounds like it. One of my dad's favorite sayings was, "There's majesty in simplicity."
Mm-hmm.
And this is sounding, it's so simple and yet it's so powerful. Well, why is that?
I believe because we are almost by divine guidance tapping into the body's fundamental intelligence. We produce these very powerful stem cells early in gestation, and generally they're just dormant. Now they do come out of hibernation for certain big stresses. It's not like they're always asleep forever unless you wake them up with some external means. It's been shown that with a heart attack, stroke, COPD, and other stressors, that the V cells may come out of hibernation for a while. The person who has a heart attack or a stroke recovers pretty quickly and pretty well. It's reasonable to hypothesize that they just had a particularly robust V cell response that accelerated the regeneration. For the most part, though, they're dormant. And it's really quite brilliant as whatever you want to call it, a gift from Source, Creator, whatever name you give that energy, this divine, supreme intelligence, that these cells are designed not only to stay much, much younger than the person is biologically, but to be able to make anything. So instead of replacing the damaged or senescent neurons in the brain, or the cells that have been lost, with old cells, replace them with young cells that have lots of life in them yet, or generates the heart with young cells, or any other tissue of the body. And there are two things that are really relevant. One is the question of what do you treat the most? And by far, the protocol we do the most is just for someone who wants to get biologically younger. And there we focus on the tissues that are the slowest to regenerate. And while we know the brain has 3 types of stem cells, it's a question of how many do you lose versus how many do you replace. And that over time, the balance is in the direction of loss unless you do something to reverse that. So our core protocol sends the cells to the brain, the spinal cord, and the major endocrine glands, which also have an issue of slowness to regenerate.
Excuse me, for the 8th graders out there like me, the endocrine system would be?
I was going to explain that, but thank you for making sure. The endocrine glands are the glands that make hormones. And the main ones are the pineal, which makes melatonin, the pituitary, which makes multiple hormones that controls other glands that produce hormones, thyroid for thyroid hormone and metabolism, thymus, which makes T cells of the immune system, adrenals, plus or minus the gonads. And there we always ask the men and women if they want that, because this could restore fertility even if people were past the point that would normally be possible for men and women. And that's what we do the most of. The other point that is our theory, we'll have to do some work to prove this system by system, is that the most profound thing the V cells appear to be doing, getting back to your question of how can something that's this simple be so powerful, is that recalling that the V cells are just after embryonic in the chain. And they're the first type of stem cell that's safe to use. That's not going to grow giant hairballs. That from there, you have the three primary germ layers and all the other individual tissue type of stem cells. And what we believe is happening is that when we inject the stem cells, they're small enough to go to the lungs and they go everywhere from head to toe. And then our laser guidance protocol, which we start even as the cells are going in, because they're looking further home. We don't want them all to go somewhere else before they go where we want them to go. And then goes typically for 20 or 30 minutes afterwards. That this is a quantum process. It will enhance the probability that a cell goes in the volume of tissue where you want it to go. So, say, for something localized like Parkinson's, if we want to enhance the regenerative effect, we know exactly where the problem is in the brain and we'll send it from 3 different directions so that where that signal intersects gives the strongest signal for where we want the cells to go. Even though we're increasing the probability, we're not sending all the cells there. We're just sending more than we would have otherwise. Then there's also inflammation in the body, which will attract cells to go. That's another type of attractor field. And then the cells that go either to where the laser guidance is or the inflammatory signals are, we believe those cells distribute all the way through the body from head to toe, probably as a function of blood flow. Like it gets 10% of the blood flow, it probably gets about 10% of those cells. Mm-hmm. And because these cells are at the tip of the top of the differentiation chain, we believe we're not just replacing adult cells with much younger cells, we believe we're actually replacing stem cell pools with younger stem cells. So all the stem cells in the body are getting younger from head to toe.
That has to have a profound effect on overall health.
Mm-hmm. When we look at the effect on biological age, before we did before and after testing, what we found was that if someone had done one treatment in the past 5 years, they were roughly 3 years younger biologically than their birth date age. And if someone hadn't had a treatment in general, they were as old or older biologically than their birth date age. So anything less than that appeared to be an effect of providing these very young stem cells. Now, other things can make people 3 years younger. There was a study published by Dr. Fahey using growth hormone, DHEA, and metformin that after a year made people 3 years younger. So 3 years had already been done. However, after 5 years, that went back to baseline, so it didn't stick. With the V cells, after 5 years, it still appeared to hold. Now, what's even more interesting, if someone had had 2 treatments, they were 6 years younger. And if someone had had 4 treatments, they were 12 years younger.
So 3 per treatment.
3 per treatment.
Is there a time frame that you have to wait? I mean, in terms of treatment, is there a time frame, like you get one treatment, you wait 3 years, come in and do another one, or is it?
It depends on the purpose. In the basic distinction there, is it just for age reversal, or is it for a particular condition?
Age reversal.
If it's just for age reversal, you have choices. The simple logic would be if the clock turns back 3 years with each treatment, if you did a treatment every 3 years, you could be ageless. You could literally just stay the same age. If you did treatments more often, say every year, you could get gradually younger year to year.
Turning back the clock. Okay.
And then if you really wanted to push the envelope, you do treatments more frequently. And we tend to see the regenerative effect of a protocol, of a treatment, to be at its plateau at about 3 months. That's what we saw with the heart regeneration study. And that's what we've observed with other things, that things tend to get gradually better, and then they tend to hit about the maximum effect from that treatment at about 3 months. It can be long, it can be 6 months or more, but 3 months is a reasonable place where most of the points fall. So those people that want to push the envelope, how much can they push the biologic age reversal effect? Dr. Doug coined the term rejuvenauts, which is those people that are really pushing the envelope of rejuvenation. And for that group, it's typically once a quarter. That's what I do and others in that group do. And there's an enlarging group of us that are 12 to 18 years younger biologically than our birthday age. And we haven't hit the limit yet, because that is what we've observed over just the first 2 years of having the testing.
Goodness. So in terms of people who shouldn't get the treatment, are
Bad people.
I agree. Are there patients or individuals that have something, and what are the no-goes? I've heard with stem cells, for instance, that cancer patients, not a good idea. But maybe it's the type of stem cell, again, that the hierarchy. Maybe cancer is not a contradiction.
That is really a very insightful way of looking at when you might not want to do the procedure. And we have tended to refer oncology issues to other practitioners that are really good at doing more sophisticated protocols for that issue. It's quite a different mentality from regenerative medicine. Regenerative medicine is a tissue that's kind of beaten up and worn out, and you give it the cells that it needs, and it functions more youthfully and better. That's really our expertise, our forte, and our focus. That said, there is some basic science work that we're doing in the area which could suggest a role for these cells. And there again, it's matching the scenario to the timing and the way the cells are used. Nothing to really say about this point, but there's some promising new evidence that suggests that the cells can help to rebuild the immune system and make the body more effective. And it's a much more complex stack, and different types of tumors have different approaches. So it's a lot more metabolically complex. It's one thing when we want to make the tissue grow and regenerate, versus there's some tissue that's going like crazy and you want to put it back in balance. So I'd say in general, we've really been focused on age reversal and allowing people to be younger, stronger, fitter, healthier, smarter, in more youthful. But literally, the basic concept would be turn back your aging clock 4 years, relive those years, and if you modify diet, lifestyle, exercise, the way you train or discipline, or just having more fun, that after 3 years you can actually be a better version of yourself than you were 3 years ago, and continue to that. That's our main focus. So I think we may well have a significant contribution in that area, but at this time we're not looking for oncology patients, persons that have one type of cancer or another.
What about in general? If aside from cancer, are there any individual conditions or who would not be an ideal patient for V-cell? It sounds like there aren't many of those around.
The main one that we would say would be cancer, particularly leukemia, which is a whole different animal because it's cancer of the bone marrow and working with blood. Other than that, if someone has a coagulation disorder, and there's a risk if you're drawing blood and taking blood that there could be a bleeding issue. We might want people to not be on blood thinning medication for a while, at least before doing it, for a little while after, so that there's no bleeding hazard that's created just by doing the mechanics of the procedure. And since we're really only returning to the person what was just in them, there's not really an issue of sensitization. There's a little bit of anticoagulant in the tubes, but I don't think we've seen any sensitivity to that. So the contraindications are pretty few. You know, someone might be psychologically incapable of having their blood drawn, and that would be a factor. And some people, it is a problem, even to have access to draw their blood, or if there's some sort of.
There's nothing. It sounds like there's nothing major. I mean, nothing major that would prevent someone from, aside from the leukemia.
Right.
I would assume bone marrow cancer, which my dad had, multiple myeloma would be a no-go.
Yeah, well, that's in that classification of leukemia, lymphoma, blood dyscrasias. I mean, it's a marrow type of cancer, basically.
Right. So the most important thing, of course, is having expert advice from a physician who's familiar with this,
Right.
to guide a patient, and that goes back to whose door are you knocking on?
Right.
Yeah.
Right.
The expert. I want to ask about what you're seeing in the future a little bit. Go 5-10 years out. What are you looking forward to? What are you seeing? What's exciting? What should we have on our radar screens?
I'd say the biggest kaleidoscopic landscape of coolness for the next, say, 10-year landscape is that we're learning more and more about the subtle information systems in the body and the subtle metabolic pathways of the body. And what we're combining this work with now is epigenetics. So you've probably heard of 23andMe.
Sure.
And they're what are called SNPs, which is a cute way of saying single nucleotide polymorphism, which in layman's terms means that there's 4 DNA bases, ACTG. If you change a single one of those in the right place or the wrong place, in a precisely defined place, you can change the amino acid that goes in a particular place, and you can radically alter the function of an enzyme or a structural protein. So this one little teeny tiny change, this one letter change in a string that might be hundreds of characters long, can radically alter how something works in the body. And some of those are really major and have significant health consequences, like this SNP for folic acid called NTHFR. You've probably heard about that one. It's one of the more popularly described ones. So you need to take methylfolate instead of folic acid for that to work properly in general. And there's hundreds of them. And everybody's is different. So in addition to what I believe is the flagship of regenerative medicine, we actually published a review article on B cells because of these characteristics, being very small, getting everywhere, being pluripotent, turning back the aging clock, reversing the age of stem cell pools from head to toe. For many instances, it's going to be a very good choice, and probably the most ideal choice for a number of circumstances. That's where you start, but that's just one piece of the equation. Then layered on top of that will be individualized genetic metabolic optimization based upon the genetic profile that you're born with. And we have an artisan named Terry Cochran who is expert in that area, who's working with us to develop algorithms so people can define, based on their profile, what are the ideal things to eat, not to eat. What are the foods that sound good for you that can actually be bad for you. Then there's another layer of peptide science. Peptides are small molecules, strings of amino acids that are smaller than proteins that can be very powerful for information. So there are peptides that can allow you to build muscle faster in the gym, that can burn fat, that can enhance cognitive function, that can help to heal leaky gut. There's a peptide for almost every single function of the body to enhance it, and then you can stack those in certain ways. So on top of the genetic optimization, you can layer informational optimization, you can layer nutritional optimization, you can layer physical sports performance optimization, you can layer mental optimization, you can layer psycho-emotional medicine to create this hierarchy of how someone can be almost as young, fit, strong, healthy, and even cognitively enhanced that they might like to become.
Wow.
How's that?
That is exciting. And I know a lot of people would hear, wait, burning fat? Sign me up.
I'll take that one.
I'll take that one. Yeah, that's a big industry right there.
It is.
So, one of the funny things.
Exercise helps too.
Yes.
Side note.
Yes. How do you practice optimal health? What do you do?
Everything.
Everything. What's everything?
What do I do?
Yeah.
My program?
Yeah. In a nutshell. In a nutshell.
Well,
Some of the things.
the key things.
Key things.
The B cells every quarter. I'm in that group that's doing that. And I'm in that group that's in that minus 12 to 18 range. I actually formulate, manufacture, and clinically study laser-enhanced nutritional supplements. So I've formulated 30 different compositions, either for general health, age reversal, detox, strengthening different systems, antioxidant effects. So I have a personalized nutritional metabolic program, most of which I formulate and produce and laser enhance myself.
For you.
For
Based
no,
on-
for anyone.
For anyone. Oh,
No,
okay.
it's I have the nutritional supplement company. We can say the name if it's allowed.
Go ahead.
No, it's called Gematria Products, and some of them are on the shelf.
Ah,
Mhm.
conveniently.
Yeah, there are actually 3 forms that we give to everyone that receives stem cells. And it's just I'll just describe one of them. It's a nucleic acid product, which provides the individual basis of DNRNA, which is based on an animal study that doubled and tripled the lifespans of animals just taking nucleic acids supplementally. We did a clinical study with that formula in middle-aged persons who took either the active or the placebo, and then were told to walk briskly for 60 days. The placebo group had no change. The active group gained 12 pounds of muscle loss, 15 pounds of weight, and increased aerobic fitness by 8%, literally becoming 8 to 12 years younger biologically by taking a supplement for 2 months, for example.
And that's on the shelf right now?
Mhm.
Really?
Yeah.
Javier?
You can get one.
Yeah.
So there's that. And then there's actual fitness, the actual physical routine. And I work with a trainer who himself was an Olympian, 3-time world champion bodybuilder, who was a trainer for Mike Tyson, Kobe Bryant, MMA champion fighters, and champions in a variety of sports, who is an artisan of how to enhance physical performance in really extraordinary ways. And he was the person who first taught me about peptides. We began using it in our program. That's how I got that through my personal use and experience with him. And in a 2-week training period, I gained 50% muscle and lost 30% total body fat, for
Wow.
example. So my fitness metrics are comparable to a 25-year-old elite athlete right now, in his estimation, and he works with those people. And then there's an hour of meditation every day.
That's, yeah. My dad's quoted in Forbes in the Business of Life that everyone should take time for mental self-renewal.
Makes a big difference.
Yeah, yeah. Just something to let your mind go, release.
And yoga and martial arts practices, so it's a pretty big stack.
Yes. Well, it's working. I mean, there
It's
you are.
working.
So, are there any longevity secrets that others can follow? That you know, a couple of them. In
Longevity
general?
secrets.
Yeah.
Sure. I mean, there's always the basics. right?
Start there. Yes.
Always
Foundation.
the basics. Proper diet, and then once more of that, because that's a long discussion.
Sure.
Being physically active. The longest lived people are also physically active. Nutritional supplementation in an intelligent way makes a difference because we don't necessarily get everything we need in the diet anymore. Stress reduction, however it works for a person. Meditation is great for me. It can be yoga, it can be listening to music in a certain way. But for a period of time each day, at least 20 minutes, preferably an hour, get into as relaxed a state as you can. Our culture tends to drive people to fight or flight almost all
Yes.
the time. It's good to get into rest, digest, and regenerate.
Yeah, it's stimulating. That the negative stimulus that we have is so great, and it's something that I know my father was he was a very positive mental attitude person,
Right.
and in fact his cancer doctor said, you know, your dad lived a lot longer. This is back in the 80s. He said, you know, your dad's attitude kept him alive a lot longer than the usual patient.
Mm-hmm. Right.
It's amazing what
important.
happens.
It's powerful. And then I say mental discipline, whatever that means, because there are many ways to discipline the mind: yoga, martial arts, practices that may include so-called mantra. There's many ways to meditate. So I would say discipline of the mind, so that the power of the mind can also be used for being in the best health, the best state, the most energy, the most fitness that you can. So it all works together. We have to kind of build from the bottom up. And the more you do of any of those things, the more it makes all the other things easier.
Last question. I appreciate your time and your expertise. It's been fascinating for me. If there's one strategy to follow in order to gain optimal health, better health, what would it be?
Just one out of all the ones that I described.
Yeah.
The single most important strategy of all of them, calming the mind.
Calming the mind. Now, my bet is most people watching this would have said diet. Calming the mind. So, going
And becoming internally aware of what's right for you. The driver of probably the majority of overeating is that it's used for stress reduction.
True.
Whatever the personal practice is to calm the mind, to get into a relaxed and balanced state and go within, and then just get the guidance for what's best for you. If I can give one recommendation, that'd be it.
Calming the mind. That was surprising. I would have bet diet. In fact, I would have said diet.
Mm-hmm.
Because
Or
diet-
exercise.
Yeah, diet or exercise.
Mhm.
And I try and do both. But
Mhm.
now next on the list, the hit parade will be calming the mind. But you know, this might be a little hard to do. The nice thing is down here you can turn things off from up north.
Right.
So you can tune it all out, which is a lot tougher to do up north. Well, Dr. Todd, thank you so much. And it's been a pleasure to meet you, and
It's
it's a
been a
pleasure
great
to
pleasure.
learn. And the fact that I grew up about one suburb north of where you went to school.
That's crazy
It's a
cool.
small world down here.
That's a small world.
So on behalf of Xtend Optimal Health, I'm Hunter Schultz. And there you are.